If you've had blood work done and you've been told that your numbers look good, they look normal, I want you to go pull that lab report up sometime. Look at what's on it and then look at what isn't, because there is one test for insulin resistance that almost never gets ordered, and it was never ordered on me way back in the day, not once when I was overweight and struggling. It was quietly running my energy, my hunger, my body. It's not an expensive test. It just wasn't on the form. But you don't even actually need the test to have been run to know something's been happening. Your body's been keeping a record where you could see it the entire time. There's 7 places on your skin, so let's go read them together. I'm Dr. Jones, DC, and I coach thousands of patients through metabolic health, and insulin resistance is almost always the problem underneath all of it. It was the problem underneath mine too. What I can do is tell you exactly which labs to ask for and show you the 7 places that your body has been trying to tell you already so that you understand the urgency behind this. Okay, number 1, the back of your neck. Reach back right now and run your fingers across the creases where your neck meets your shoulders. Don't look, feel. There's a patch back there that's thicker than the skin around it, a little velvety, almost like corduroy under your fingertips. You just found something that has a name. Then get your phone, turn the camera around and take a picture, because it's darker too as well. And you have almost certainly never seen this. It's called acanthosis nigricans. That's a medical name that just means dark, thickened skin. And here's what keeps people from ever mentioning it to anybody. It's not dirt. Almost everybody that I've talked to about this scrubbed at it at first. A lot of them were told as kids to go wash their neck properly, so they scrubbed harder and it stayed. Nothing was ever on the surface. That's why it wouldn't come off. The skin there, it didn't get dirty. It got thicker. And here's why. When insulin levels are high in your blood, it doesn't only talk to the parts of your body it's supposed to. It can also land on receptors sitting on your skin cells. And it tells them one thing: multiply. So they do. They pile up. And skin that's piled up extra layers reflects light differently. It looks darker because it is thicker. And that patch on your neck isn't a stain. It's a pile. And the thing that told it to pile up was the thing that nobody's measuring. Okay, so number 2, skin tags. And most skin tags mean nothing. If you've got a couple of scattered tags, that is almost certainly nothing. That's skin doing what skin does, rubbing, aging, being skin. So let me tell you when skin tags actually count, like when you should be worried. When there are a lot of them, when they're clustered in a single spot, single area, not scattered, one here, one there. When they show up in folds, the armpits, the neck, the groin, underneath the breast tissue. And most of all, when they're sitting next to the velvety patches that we just talked about. 1 skin tag on your eyelid is a skin tag. 15 of them in your armpit next to a dark patch that you've been scrubbing for over a decade. It's not a coincidence. That's the same message printed twice. Same signaling behind it as the neck. On the back of your neck, the cells grow flat and they pile up. In the folds, where skin moves against itself all day, they grow outward. Same signal, but different part of the body. Now I already know what some of you are saying, because my patients say it to me before I finish the sentence. Come on, it's just friction. It's my age, or it's my collar, or I just need to do a better job washing. And you're not crazy for saying that. Friction is part of how tags form. That's why they show up where things rub, but it doesn't explain why your friend in the same collar has clear skin and you have 15 tags. Rubbing gives cells the chance to grow. It doesn't give them the order. Friction doesn't give the order on its own. Insulin levels do. And listen, if you're standing there realizing that you've got some of these already and you've been told nothing's wrong with you, that free discovery call that we offer is where you can find out what working with our team on this could actually look like. You'll talk to one of our patient educators about your situation and what you've been dealing with. You can text the number on the screen or check out the link in the description if you want to look into it. Okay, number 3 is adult acne. Not teenage acne, acne that showed up at age 32, 40, and plus. Along the jaw, the chin, the lower cheeks, deep, sore, cystic, the kind that doesn't come to a head. If you didn't have acne when you were 15 and you have it now, the question isn't what changed in your skincare. The question is what changed in your hormones. Number 4 is for the women, hirsutism. That means coarse, dark hair growing where men grow it. The chin, the jaw, the upper lip, the chest, the abdomen. Not the softer hair that everybody has, the other kind. The kind you deal with privately and don't discuss. Okay, so 5 is thinning hair on your head, which is the cruelest one because androgens do the opposite thing up there. They thin the hair on the crown and widen the part. It's called androgenic alopecia. That's hair loss driven by hormones, and it's a sign that people grieve. It's also the sign that sends people to a dermatologist where they'll get an excellent conversation about their hair and no conversation at all about their insulin levels. In the female patients that I coach, these last 3 travel together most often in PMOS, formerly known as PCOS, polycystic ovarian syndrome. On its own, any one of them has a dozen other explanations. Acne is common, hair changes are common. So don't take number 3 by itself and try to diagnose yourself. Take number 3 sitting next to number 4, sitting next to a velvety neck. Now you're not looking at 3 problems, you're looking at one problem that's showing up in 3 different places. Here's the thread running through all 3, and it's one word: androgens. High insulin levels pushes the ovaries to produce more of them. This is male hormones. And it drops the protein in your blood that normally keeps them bound up and quiet. So you end up with more of them moving freely, and androgens, they don't do one thing. They do whatever the follicle they land on is built to do. On your jaw, they tell the oil glands to run hot. On your chin and your lip, they wake up the hair that was never supposed to be coarse. And on your scalp, they shrink the follicle down until the hair coming out is finer every single year. Same hormone, 3 completely different results. Now, before I go on, could you explain to somebody why acne on your jaw and hair leaving your head are the same problem? Say it out loud here, because if you can, you've already understand something that most people never get told. And if you want the full breakdown on why those 3 travel together, let me know in the comments. If enough of you want it, that'll be one of the upcoming videos that I'll plan to film. Okay, number 6, things take too long to heal. A cut on your hand that's still there in 2 weeks, a scrape that scabs, reopens, scabs again. This is a sign that you don't see, but you feel it. When insulin signaling is broken, the repair machinery underneath your skin, the blood supply, the collagen, the immune cells that clean up a wound normally, they run at a lower gear. Number 7, skin conditions that you already have, getting worse than they should. Psoriasis, for example. Hidradenitis suppurative. Those are the painful recurring lumps in the armpit and groin that people are often told are just bad boils. Insulin resistance isn't what starts these, but it travels with them. And the people that I see who have both, they have a harder time. Every one of these 7 signs has innocent explanations. Skin tags, they run in families. They come with age. They come from friction. Exactly like you said. But that dark velvety patch has some explanations that are not innocent at all. If yours came on fast, weeks, not years, if it's spreading wildly across your body, if it's on your palms, on the soles of your feet, or inside your mouth, that is not a metabolism conversation. That is go see a doctor this week conversation, because that pattern can point to somewhere serious and it deserves a real workup. Certain medications can produce it as well, steroids and some birth control pills. So do some hormone conditions that have nothing to do with insulin. So 7 signs, 7 places on the outside of your body. And here's what all 7 of them actually are. They are not the disease, they are the printout. Every one of them is the same report, written in a different location. Your cells breaking down from the inside out, and your skin writing it down where you could see it. Which brings us to the part that's going to make some of you angry, because a lot of you have been to the doctor. A lot of you have had your blood drawn, and the paper came back and they said you were fine. Before I explain why the blood test said you were fine, be sure to hit that subscribe button right now, because that's it. That's the whole ask. I break down the metabolic stuff that never makes it into a 7-minute appointment, and the next few minutes are the part that I'd want my own family to hear. So let's talk about that piece of paper. When you go in and they check you for a blood sugar problem, they run one of 2 things: fasting glucose, how much sugar is floating around in your blood this morning, or your A1C, roughly what your blood sugar has averaged out over the last 3 months. Now, both of these tests are excellent. Both of them are measuring sugar, but neither of them are measuring your insulin levels. And insulin is not the sugar. Insulin is what your body makes to deal with the sugar. Now, most people think of it as only the blood sugar hormone, but it isn't. Insulin is a storage hormone. Its entire job is to take what's in your blood and put it away into your muscles, your liver, your fat. So when your cells stop listening to it, your pancreas doesn't give up. It shouts, it makes more insulin until the cells finally hear it and your blood sugar comes back to normal. That is the trap. That is what I call the normal labs trap. The test isn't lying to you. The test is measuring the result, and the results look great because your pancreas is working double shift to keep it that way. Nobody is measuring the double shift. So let me map this out. The bottom line is time, years of your life. The flat one is your blood sugar. The line they tested, steady, boring, normal. Every appointment, every year. And this one here is your insulin. Look at where they start. Same place, same day. Then one of them leaves. That space opening up between them, that gap is part of your body that nobody was measuring. And in the patients that I coach, that gap has been widening for 3, 6+ years before the test that they're running would ever catch it. 3 to 6 years of your life with the answer sitting right there, one line away on the same sheet of paper. Here's what living inside that gap feels like, because I've personally lived it myself too, and I've seen it over and over again. When insulin is high all the time, your fat cells get locked into storage mode. Almost nothing comes out. You got a full tank of gas and a locked gas cap. Calories are the fuel, but insulin is the key. You can drive all day with a full tank and doing everything right and never once get at it. And now the part that always gets pushed back, so let's have it out. Somebody watching this is saying, come on, I'm not overweight. You're inventing a disease so that thin people can have one too. You are not looking at all of your fat. The fat that you can see, the fat underneath your skin, the fat that you'd pinch, that's not the fat that mainly drives this. The fat that drives this actually wraps around your organs and it packs itself stuff inside of your liver. You can't see it in the mirror, you can't see it on the scale. Two people can weigh exactly the same, wear the same size, and one of them has a liver full of fat and the other doesn't. So the objection is right about one thing and wrong about the conclusion. You are not overweight. And it was never about being overweight. It was about where the fat is sitting, and yours is sitting somewhere that you can't see. All right, real question here. Answer it before you keep watching. If your friend came to you tomorrow and said, my doctor says my blood sugar is perfect, so I'm fine, could you tell her why the numbers looked perfect? Take a second with that, because it's so important. And do me a solid here. In the comments, let me know which sign made you stop the video and go check. Tell me which ones that you first noticed and what you were told it was if you ever talked to anybody about it. Not because I'm going to diagnose you, because I can't. But somebody is going to scroll down here tonight, see your comment, and realize they're not the only person who's been scrubbing their neck for 10 years and seeing nothing change. So the test wasn't wrong. It just was never looking. Okay, so I told you at the top of this video, I'd give you the name of it, and here it is. And I actually said it earlier. It's the fasting insulin test. That's the test. 3 words. You ask them to add the fasting insulin to your blood work. Same blood draw, same morning, same needle. Now, one more line on the requisition. It looks at the gap instead of the result. That's why it can be abnormal for years while everything else on your panel reads perfectly. It isn't a blood sugar test. It's measuring a different thing entirely. I'm not going to give you a number to hit. That's a conversation with a clinician looking at all of you, not a number that you get off the internet. And I'm not the person who orders it. My medical team actually does. But I can tell you, generally speaking, you want that fasting insulin on the lower side of the reference range, depending on which lab that you're ordering from. What I can tell you though, it's not a hard test to ask for. It's just never been offered to you. You didn't need a better doctor. You needed a different line on the form. And getting the number is the easy half. A fasting insulin result sitting by itself next to a normal range, so wide that a lot of people land inside of it, doesn't tell you much. A number means when somebody reads it against everything else that's happening in your body, against the inflammation, against your thyroid, against the 7 things that you just found in the mirror. That's not a lab result anymore. That's a clinical picture. And I want to end somewhere other than a lab test, because a lab test isn't what this video was about. Think back when the first sign showed up, not when you noticed it, when it showed up 2 years ago, 5, maybe you were a teenager. You had an explanation for it then. You always did. It was stress. Work was brutal that year. Then it wasn't stress anymore, so it was age. You're not 25. This is what happens. Everybody says so. Then it was sleep, and when none of it held, it was genetic. Your mother had the same neck. Her mother did too. That's just what your family looks like. Stress, age, sleep, genetic, around and around. The blame loop, I call it. And here's the cruel thing about it all. Every single one of those explanations was reasonable. Stress does affect your skin. Aging does change your hair. Sleep does matter. And it does run in families. There's a genetic piece to this. That's exactly why the loop holds. It never gives you a reason to stop and question any of it. It just hands you a plausible answer every time forever, and none of them ever asked why all 4 things were happening to the same person all at the same time. And I hear a version of this constantly, and it always comes with the same phrasing. I didn't even know those were symptoms. I didn't even know until someone finally told me. Nobody in that story did anything wrong. You were just paying close attention. You just kept getting handed the wrong explanation. Before I let you go, be honest with yourself for a second. Of everything that I showed you today, the neck, the tags, the acne, the hair, the years of explanations, how many of them are yours? 1, 3, or more? Sit with that real number, not the number that you'd like it to be, where you're actually at. So here's where I'd leave you. You're going to get that test. Good, go do it, but you'll get a number back. It'll sit there and it'll be next to the normal range, and you'll be right back in the same room that you've been in for years, holding a piece of paper that nobody will read with you. One number doesn't end the blame loop. Somebody looking at that number next to your inflammation, next to your thyroid, next to the 7 things that you found out on your skin today, that's what ends it. And that's what the free discovery call is for. You guys can text number on the screen or use that link in the description. You'll talk to one of our patient educators. They'll get to know your history, what you've been told over years, and where you actually want to end up. You'll get a feel for what it's like to work with me, our coaches, and our medical team, the whole process down the road. And then they're going to walk you through the programs and the pricing so that you can see what this actually looks like and where you could be a year from now. You've spent years having this explained away. Go get it measured. Now you know what it is and you know what to ask for. What you don't know yet is how far back this goes or how much of it you can actually undo. I made a whole video breaking that exactly down. Check it out. We'll see you later.